Welcome to the Stay Healthy El Paso podcast, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. This podcast is presented to you by Dr. David Midoff, expert physical therapist and owner of El Paso Manual Physical Therapy. It is our goal and intentions to provide you with valuable tips and insights from experts in the El Paso area so you too can stay healthy, fit, and energized. Now here is your host, Dr. David.
Hey there, welcome to the Stay Healthy El Paso podcast. My name is Dr. David Midoff, and I'm a specialist physical therapist over from El Paso Manual Physical Therapy. I'm your host for the podcast, and I'm going to be talking with you today about back pain. Specifically, I'm going to be answering a question that I got from a client this week. She asked me, do I need injections for my disc every 3 to 6 months? Now, I'm going to answer this question and talk more, but real quick, I just want to let you know that if you have back issues and you're looking for help, free help that you can do at home, doesn't require you to go anywhere or buy anything, head over to our website at epmanualpt.com. That's epmanualpt.com. And you'll find tons of free helpful resources. On the homepage, you'll find stuff. And if you go over to the blog tab on the top of the page, you'll see a massive blog. You can also hear our podcast. If you probably have discovered our podcast, obviously, if you're listening to this. But if you want to see more episodes, you can hit the podcast tab up top, and you'll see all our other podcasts. So I hope that can help you out if you're looking for help with your back problem or anything else. We've got lots of helpful content on sciatica, on knee problems. There's lots of information out there that's free for you guys on our website. So let's get into the question here. Do I need injections for my disc every 3 to 6 months? This poor lady, my heart goes out to her. She's been getting injections about every 3 to 6 months, depending on when the effects of the injection wear off, because she does get relief. The pain goes away, but then it kind of creeps back in after a few months, and she goes as long as she can before she feels like she needs to go back to the doctor and request another injection. And she came in telling me all the information the doctor gave her, which is spot on. They don't allow you to get more than 3 to 4 injections per year because it's dangerous. There's side effects to getting these cortisone injections. And as I'm going to tell you about that, the specifics on it is cortisone, the drug that's commonly injected into the lower back whenever you get a pain injection. It's a pain reliever and an inflammation reducer. And so what that means is, of course, it as long as they hit the right area and they're accurate in that, because that doesn't always happen either. There's times where injections happen and people don't get any relief, and it's usually because the target tissue was missed. But that doesn't happen too much, but it does happen from time to time. Well, it does relieve the pain, and then it relieves the inflammation in the area. And there's known research showing that it breaks down connective tissue over time. So what you have to understand about connective tissue, it's a type of tissue in the body, kind of like muscle tissue or nerve tissue or bone tissue. Connective tissue is everywhere in the body, but especially in the spine, because tissues like discs, like in the spine, ligaments, tendons, even parts of bone are made up largely of connective tissue. And what connective tissue is it's kind of like glue, or it's what puts everything together. It's what holds things together. So like a tendon literally connects a muscle to a bone. A ligament connects a bone to a bone, one bone to another bone. Cartilage cushions bones on bones. And then there's parts of bones that are made up of connective tissue as well, because it needs to connect itself. So it kind of makes the framework for a lot of our body parts. It's really important because it holds things together, and you need all that to work properly in order for you to not have to think about it. If you're not in pain, you don't really think about your body too much, but once it starts to hurt, then you're thinking about it all the time because it's stopping you from doing certain things that you want to do. So anyways, going back to the story, this lady has known about her connective tissue damage, or the possibility of it. She hadn't told us she had any yet. Well, at least from what she thinks. She hasn't had an MRI yet, so she doesn't know about the situation in her disc in her back, but she suspects that she has a disc herniation. That's what the doctor told her. That's what she thinks. I checked her out, and I think so too. But she doesn't want to have an MRI, which I encouraged, because I think that it's pretty obvious that she has a disc issue. And I said, if you want to get the MRI, go for it. You're probably going to find a disc issue, but it's not going to change her treatment here. But she was okay with that. But some people want to know the status of their disc, and so they'll go get an MRI, and that's perfectly fine. It's not necessarily a bad thing to get an MRI, as long as you know how to interpret the information. And I'm not talking like on a medical level. What I mean is, you have to understand that whenever people get MRIs, something's typically found, especially as you age. It's just way more likely that they're going to find something wrong on your MRI, and it might be interpreted as something severe or something not severe. And now, how your doctor interprets the severity of the back problems, that's up to the doctor. But you just have to know, is this something that's normal for my age? This finding on the MRI, is it expected, or is it not expected at my age? Is it severe? Is it moderate? It's okay. We know that as early as people in their 20s have what we call positive MRI findings, meaning there's like some minor disc herniation or beginning signs of arthritis or something like that. And as you get into your 50s and beyond, it's like guaranteed almost you're going to find something. The percentage of people that have something, it shoots up past 80. I think when you're in your late 80s, it's like 100% guaranteed that there's something's going to be wrong on your MRI. But the cool thing is that if you have positive MRI findings, it doesn't always mean that that's the reason why your back is hurting. And there's hard evidence to back this up in the scientific research. Now, it is possible to get better from a back problem despite having a herniated disc. And even if you have an MRI afterwards, after you feel better, obviously people don't do that really because they're better. Why go get another MRI? But they find that there's people that have positive MRI findings that don't have any back pain. So that could definitely be you if you're dealing with a back problem and you know that you've got an MRI issue. But anyways, that was a side note just to tell you the reasoning why I told her that she didn't need an MRI. But going back to the story, so what ended up happening, I told this woman, you don't need to get injections every 3 to 6 months. It's not good for your connective tissue. You probably have a disc herniation. And truthfully, if you keep getting these injections, because that cortisone medicine that's injected breaks down connective tissue, it's probably going to make your disc herniation worse. And then we're not going to be able to effectively say if it's because of something that you're doing, as far as the way that you're moving, your other issues in your body, like your strength, your activities, the things that your postures, the things that you're doing every single day, or was it a result of getting the injection and repeated injections over time? Who knows? But either way, let's take away factors that are pushing you towards making your back problem worse. Now, to answer her question, do I need injections for discs every 3 to 6 months? Here's what I told her directly. Like, this is what I told her in the moment, reflexive answer that I gave her right away, because it's probably what you want to know. It depends on your immediate goal. This is what I told her. I said, ma'am, it depends on your immediate goal. Are you looking to get short-term pain relief? Like, you cannot sleep right now. You are missing out on more than 50% of your sleep consistently. Your relationships are being affected by your back problem. Like you're grumpy, you're not nice with your husband and your kids. She has grown kids that she still has at home. And she goes to work still. And I said, at work, are you your normal self, or are you a little grumpier than normal? And she said, no, I'm definitely grumpy. I'm not sleeping enough. I wish I could sleep more. So I said, okay, well then that checks out. Then I asked her this: do you think that the injections for your back are healing your back problem? And then she said, well, yeah, because she didn't know any different. And then I said, okay, let's figure that part out, because it doesn't heal your problem. It really just masks it. It's a Band-Aid problem. It's a Band-Aid solution. I mean, the injection just takes away the pain and inflammation temporarily, but it doesn't fix a long-term problem. So then, knowing that, I told her, I assume that you're interested in fixing this back problem for the long term, because it had been going on for more than a year. She's had injections over the past year. And I told her, if you want to get this problem fixed for the long term, then you need to stop getting injections in the short term. Of course, get one if you need sleep, because it helps you in that situation. But you need to do something like what we do here for El Paso Manual Physical Therapy, where we can help you get that long-term relief for the problem. And not only, I'm not talking long-term like more than 3 to 6 months, like an injection might give you relief, because that can be taken as long-term. I'm talking about the rest of your life. If you can learn what to do to manage your back problem, because everybody's got a tendency, some people are predisposed to getting diabetes, for instance, or cancer even. But it doesn't mean that you're going to get it. If you manage your health, for instance, if we go back to diabetes, we know that diabetes is connected to not eating healthy. So if you eat healthier, whatever that means for you, because it's different for everybody, and you are overall more fit, you manage your fitness a little better than you're managing it now, you're very likely going to never have diabetes, or it's not going to get as bad as it could if you let your health go completely. But you're predisposed. We know that Hispanics, Blacks, Native Americans are all more predisposed than whites. But on the flip side, whites, Caucasians, are way more predisposed to getting skin cancer than people of color like Blacks, Hispanics, and Native Americans. So that's, everybody's got their own thing. It's not, it just depends on your genetics. Back pain is similar. And it's not race or ethnicity driven like diabetes and skin cancer is. It's more your body type. Like, are you more of a slender build, or are you more of a stocky build? Those issues are more so connected to whether or not you're predisposed to get back problems. And it's not 100% accurate like races and all that. Obviously, there's exceptions. There's Anglos that have some pretty severe diabetes, and then there's people of color that get skin cancer. So there's definitely exceptions, but it's more of a trend or a pattern that you see in the medical field. And so what I'm telling you here, if you're more of a taller or a slender build, because you can be short but slender, that is what is going to set people up to have back pain more often than not. But like I said, there's exceptions. We get people that have more of a stocky build that come in with back problems, but genetically they're at an advantage to reduce the back problem really fast and not get it as often than the slender people. And the reason for that is it connects to the next part of what I told this woman who was asking about injections every 3 to 6 months. She was a slender build for sure. Now she's older. She's in her late 50s going on 60. And she's like, I'm not slender. And I said, well, relative to other people your age, and if you think about your history, you've probably been a slender person most of your life. But at this point in her life, she's not as slender as she used to be. I'll put it to you that way. She's not a big lady at all. Very, very beautiful woman. Has some pounds that come on with the years, but I think she'll probably lose them once she gets back to being healthy and can exercise like she wants to anyway. And I think she's slender anyway. But when you're slender, you just don't have as much muscle mass naturally to control the spine. And so there's more opportunities for the spine to get locked up, to move inappropriately, to injure a disc or injure a ligament or a tendon. And that's what sets people that are slender up more often to get these back issues than somebody who's more stocky. Somebody who's stocky just has more mass, is just thicker. And I'm not saying they're fat or overweight. They literally just have thicker bodies. If you think of like certain football players, football players tend to have stocky builds, otherwise they wouldn't be good at playing football. Versus marathon runners tend to be slender builds, because if you try to have a stocky football player run a marathon, they're just at a mechanical disadvantage. They just weigh too much. They're just not built to be endurance athletes. And vice versa, of course, if you had a marathon runner trying to go run, trying to go play football, they're going to get creamed because they just don't have the mass, the physical build to play up against these big guys. So that's what I'm talking about with body builds, with body types. Okay, so going back to our case here, just to keep going on my answer for her, I told her you need to consider what muscle imbalances you have, and that's something that I checked on her. And I told her your spine requires stability from 3 different muscle groups. The back muscles, the ones that run up and down the back. The abdominals, obviously those are on the front, but they wrap around to the back and offer lots of stability to the back. And then your hip flexors, the muscles in the front of your hips that go down your thigh, those muscles influence the spine tremendously, the lower back. And so you have to have proper balance between all 3 of those muscle groups in order to not put bad forces on the spine repeatedly and create some sort of bad situation for the spine. And I asked her, have you ever been told this? Have you ever thought about this? And she said, no, heck no. For context, she is a desk worker. She works in an office, I think insurance from what I could gather. And she is talking to people on the phone, talking to people in person at times, a lot of computer work, a lot of emailing, a lot of desk work. So she's not up a whole lot. And then she does exercise. She likes to do exercise classes, like there's local gyms here in town. I won't mention the name just to make sure we're all safe. And they have classes for her to take, and she goes and does classes. Like sometimes it's spin classes, like a stationary bike classes. Sometimes it's classes with weights and some cardio involved, small weights usually. She's never really been into like big time weightlifting, which is fine. It's not a big deal. But she wants to stay slender. She's trying to keep fit, not let herself get too pudgy. And she's done a good job. She overall is pretty healthy. Now, as I kept going through the visit with her, I asked her, look, it looks like you have a disc problem from my assessment here, from what I can check. It's tender right there. You have the back pain that comes on with standing for too long, for sitting for too long. She just can't get comfortable. It sounds like a disc issue from everything that I'm asking. And then we did this. I found out that her abdominals were the weakest part. I had her activate her abdominals in the way that I needed her to, because she didn't know to at first. And then we did a few other movements that she had done before that were bothering her, and it felt better. And I said, great. And I clapped. I said, fantastic. We're on the right track. You can fire these muscles and it relieves your discomfort when you're moving. Then you have an excellent shot at healing this back problem naturally so that you don't have to rely on the injections. And I told her, if you absolutely need to get an injection just to sleep enough and have your relationships be normal and not tensioned, please go get the injection. But let's start on treatment here in the clinic for your back problem so that this isn't getting worse and you're not having to get another injection after this one. She agreed to that. She said she's going to go get the injection. We'll see us here next week. We'll see if she got it. We already started. I already started her on some exercises, so she should be getting some relief real soon. But I wanted to share this story with you. What I expect to happen over time, because if you're dealing with a back problem, this is probably what you're gonna experience if you were to get treatment like we offer here in the clinic. She's going to get stronger and stronger and stronger in her ab muscles. I'll make sure of it. I'll make sure to give her the next exercise that's needed when she gets stronger, because you have to just progress over time. You can't stay on the same exercise that you start out with. It's going to get easy because you get stronger. So we have to give you the next exercise. Then we have to translate the increased strength that somebody gets in, like in this case, that this woman gets in her abs, to her everyday motion. So she's actually, this next visit, I'm going to actually show her how to use those ab muscles while she's sitting, while she's standing, while she's washing dishes at home, while she's taking care of the laundry, while she's getting on her older kids' case on cleaning up their rooms. She told me all about that. She doesn't like the rooms dirty, yet she's got, grown adults in the house. They're in college right now. But anyways, she's cleaning up the house, taking care of her family, taking care of her kids and all that. And she loves to do that. That's what she wants to do, and she's very happy to do that. But her back pain is stopping her. So I'm going to have her do some of these motions while properly using her newfound strength. And what happens inside of her body is now she's going to take pressures off of her disc that I think is injured and allow it to heal. The disc can heal. It just heals super duper slow because it's a disc. Discs are white tissue. Like if you think of cutting open, chicken or steak or something like that, you see red tissue and white tissue. The red tissue is usually muscle or arteries or veins. And it's red because it's got more blood supply. And then the white tissue is usually connective tissue, the tendons, the ligaments, cartilage, discs, those kinds of things. And it's white because it doesn't have much blood supply. Tissues with a better blood supply heal faster just because the blood brings in healing components a lot more often, and it takes away the waste components or the bad stuff a lot more often as well. But with connective tissue like discs, tendons, ligaments, it just doesn't go as fast. So it will heal, though. It can heal. I see it happen all the time. It just takes a bit more time than muscle tissue. Skin is another one that has a lot of blood in it as well. So this woman should be feeling better gradually here over the next couple of months, few months, depending on how well she sticks with her exercises. I think she'll do fantastic. And then as her disc heals, she's going to be learning how to maintain this in the long term. Because like I said, the first exercises she gets are not going to be the last exercises. Where we need to end on exercises is some program that she's going to be able to keep up for the long term. Now, she likes to go to the gym, so that's already great for her. She's into being fit. She wants to maintain her health. So what I'll be doing is giving her versions of exercises that she already likes to do in her workout classes that help to protect her back so that she's not getting worse. I also have to educate her as we go through visits on which exercises specifically are going to make her back worse, are going to feed into the muscle imbalance, because her back muscles, the ones that run up and down her spine, are way too strong. They're adding a lot of compression to the back, and that's what I think is causing the disc issue. And that needs to be addressed in order for her to take the pressure off, and we address it by strengthening the abs. I'll free up the muscles in her back by hand here in the clinic. That'll come along. It should come along nicely week to week. It should be feeling a little more freed up. But I go into all this because I want to just stress the point that injections can't fix the muscle imbalances. They can't loosen up tight muscles. They can't make weak muscles stronger. They can't free up joints that are stuck. Injections just don't do that. That's why it is not a good long-term solution. Now, you may be thinking, well, it's longer than Tylenol or ibuprofen, and I can take that and get relief for a few hours. And yeah, you're right. It will last a few months, but remember all the side effects. It's going to make your connective tissue break down, and it's going to allow the root problem, in this case, the muscle imbalance, to last longer and potentially get more and more out of balance over time. So it's critical that we address the root problem as we're going over time. Even if she has an injection, it's fine, but let's address the root problem so that you're not having to have the next injection and potentially a surgery down the road when injections just don't work anymore, because that consistently happens. When people get injections over and over again, of course, the connective tissue breaks down, but because the muscle imbalances and the other root problems are never addressed, a disc that's getting worse or some ligament or tendon that's tearing, it just keeps getting worse and worse, eventually tears enough to the point where you lose the enough stability at the connection point between the spine bones, and then you're in a surgeon's office talking about how they're going to put screws and rods back there so that they can get the stability that you need, that you lost from those tissues that are torn. But I can tell you, the physicians, the surgeons won't ever tell you that you got that tear or that disc herniation because of all the cortisone injections that you got. They won't say that because they don't think that way. And just to make sure that we're on the same page, I'm not bashing physicians or surgeons. I think they do a wonderful job with the knowledge that they have. And think about it. If you're showing up in a doctor's office like this lady did, she's in pain. She wants relief. She's tried over-the-counter pain medications already. She had tried topical stuff like creams like Bengay, Icy Hot. She's tried stretches and exercises that she found online. She's tried a bunch of stuff. She didn't just show up at the doctor's office the first chance she got when the back pain started. It was already bad. So this doctor's thinking, how can I help this person out right now, because they need my help right now today. She needs to go home and sleep good tonight. So injections is a good idea. And if we do this over and over again, the doctor's not thinking, how am I going to harm this person in the long term with the injections? They're thinking, oh, it worked last time. It was 6 months since she was last in here. Let's do another injection. You'll be good for another 6 months. What doctors don't typically know is how we can help things naturally. They just don't think in those lines. That's not their training. That's not their schooling, and it's not their fault. That's what they got taught in school. It's up to them to learn more about it, about how to fix things naturally. But that's my responsibility as a physical therapist who helps people out naturally without surgeries, medications, and injections. So you bet I'm doing this podcast so that a doctor might hear it and learn and send patients to physical therapists, the specialists that can help them. But more so for you as a patient, so that you can understand what medical professionals are doing for you out there and how they're not trying to harm you. Surgeons as well. They went through school and training for surgery, and so that's how they know how to help. They don't know how to fix a problem naturally without surgery or injections or medications. That's not their specialty. Their specialty is surgery. So if you go to a surgeon, you're asking for his specialist help as a surgeon. And that might be right for you. It just depends on your specific situation. You gotta understand and know. And that's why I put this podcast out here, so that you can know what options there are besides surgery, medications, and injections, to see if you might be a good fit for a non-surgical option, which many times people can get better without surgery, medications, or injections. But you've got to find out for yourself. So anyways, I hope this podcast was helpful for you. I'm going to wrap it up right here. I hope that you know more about injections now, and if you're considering getting one, that you can make a much better decision moving forward in getting the injection or not. And most importantly, I hope that you begin to address the root problem, so that your back issue isn't recurring, so it's not coming up over and over again and stopping you from doing everything you love to do. And the big one is, I hope that you solve it and get control over it, so that it's not stopping you later in life and you're having to get a surgery, and you're that person, that family member, that spouse, that parent, that grandparent that just has a back problem that everybody has to consider. I see that happen so much, where I just had another patient who's wrapping up their back problem, and she is looking to do a little quick getaway with her family, but she doesn't want to go because she knows that every time she doesn't sleep in her bed, her back kills her, and she takes a long time to get up in the morning. She's a little grumpy, and she doesn't want to burden her daughter and her grandkids with her back issue. So I feel so bad for her, but she's getting better. It's coming along. It's just going to take more time because she's older. She's in her 70s, and she's been dealing with a back problem for decades now. She should have addressed it in her 50s, but that's where she's at right now. So I don't want you to end up in that situation. I want you to get to your 70s plus and not be a burden to anyone, and feel confident to sleep in any bed anywhere and walk as long as you want, as long as your fitness level allows you to, and enjoy your family, your kids, grandkids, your friends, your work, whatever it is that you're doing. I want you to enjoy all that stuff. So if you're in the El Paso area and you're looking for help, please reach out to us so that we can help you out with this problem, so that you're not dealing with a back problem longer than you should. Our phone number is 915-503-1314. You can find it on our website as well. Our website is epmanualpt.com. And if you really want to hire us to help you out, call us or find the cost and availability tab on our website to drop us your information, and we'll reach out to you as fast as we can to talk more about the possibility of you working with us. We'll let you know what the next steps are if you're a right fit for what we do here in the clinic. Now, if you're like, that's a bit much for me right now, I'm just looking for some help online or where I can find some free stuff, we've got that too. Go over to our website, like I said earlier, epmanualpt.com. There are free back pain guides available there. And there's tons of helpful exercise videos, stretches, a bunch of information on our blog. If you go over to our blog, there's also a little search tool. If you look for the magnifying glass on the top menu bar, if you type in back pain right there, you'll find every blog on our website that has anything to do with back pain. And you can start working through some of those exercise videos to get some relief. We often get people that come in to the clinic and said, I actually got a lot better from the videos that you had for free online. I just want to finish this back problem up completely. And they're coming in for just a handful of visits. And then we get people from all over the world as well that email us or contact our clinic and tell us that their back problem is better as a result of the videos that we put on our blog. So go check those out. And anyways, I hope you have a wonderful day. And if you're in the El Paso area, I love El Paso, and let's get in touch sometime. I'd love to help you out with your back problem. We're here in town. Please reach out to us. Don't wait. We're a world-known expert who can help you out here in the Sun City. Anyways, have a wonderful day, and we'll catch you next time. Bye-bye.
Thank you so much for listening to the Stay Healthy El Paso podcast, brought to you by Paso Manual Physical Therapy, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. If you'd like to learn more about what El Paso Manual Physical Therapy can do for you, call 915-503-1314 or visit our website at epmanualphysicaltherapy.com. Mention this podcast for a free discovery visit valued at $100. If you enjoyed what you've heard, please be sure to leave a review on iTunes and follow the show on your favorite listening platform so you won't miss an upcoming episode. Tune in next time to get the best health tips from experts in the El Paso area.